Worldwide, coronavirus cases are surging, infecting 10 million globally and killing nearly half a million. India is number 4 in the total number of cases and has reported 20,000 new cases on Saturday. Total deaths in the United States now exceed 125,000. New York and several eastern states were able to bend the curve and bring down the number of COVID-19 cases. New cases are increasing sharply in at least 30 states in the country, including California. This is not the time to be complacent. This is the time to be vigilant. Florida, Arizona, and Texas are the new epicenters. These states were the first to lift the stay-at-home orders. Young people under 45 who crowded the beaches, bars, and restaurants are the majority of the new cases. One reason: they do not follow social guidelines. Here are 4 states where there has been a resurgence of COVID-19 cases: Texas, Florida, Arizona, and South Carolina. The upward trend in Texas began on June 12th when the state began opening businesses to 75% capacity. A red alert has been issued in Harris County, which includes the city of Houston. Hospital capacity is said to be at a critical level. Governor Abbott has issued an executive order closing all bars. Florida on Saturday reported 9,585 new cases. Majority of these cases are among the young in their 20s, 30s, and 40s. CDC has guidelines on social distancing and the use of face coverings. Trump administration or the state governments have not issued any uniform guidelines. County and city administrators have issued their own sets of rules which vary from one place to the other. Meanwhile, the novel coronavirus that does not recognize city, county, or state lines continue to spread at a much faster pace. Now, let's examine whether the Black Lives Matter demonstrations had an impact on the resurgence of COVID-19. Minneapolis, Minnesota is where the Black Lives Matter demonstrations started. Some of the larger protest marches took place in New York City, Washington, D.C., and Boston, Massachusetts. Rather than an increase in COVID-19 cases, they all show a decline. One reason could be the statewide requirement to don face masks. Most demonstrators were seen wearing face coverings. Unlike the southern and the western states, these places did not lift all restrictions quickly. An infected person does not always show symptoms. Asymptomatic persons are super spreaders. Droplets are produced while coughing, sneezing, or even talking loud. Wearing a face mask protects you from inhaling droplets from others and other persons from your droplets. When in public, maintain a safe distance of at least 6 feet. Stay home if you can. Travel only if necessary. Avoid any gatherings, including church services. If you must attend, wear a mask and practice social distancing. Wearing a face mask is not a red or a blue issue. Trump does not want to wear a face mask. That does not mean you should not wear one. We are all in this together, yet we are still on our own. This group of friends partied at a Jacksonville, Florida bar. All 16 of them tested positive for COVID-19. 7 employees of the bar also tested positive. This is what one of them said. We were careless, we were not wearing masks, and we were not social distancing. Most young people recover soon, but they also suffer during illness. Long-term effects are still being studied. In addition to the lungs and the heart being affected, neurological damage has also been reported. The young infected person may be going home to a relative with underlying health conditions. Older persons are more likely to be infected and 12 times more likely to die. Stay safe, stay healthy.